Hi everyone, welcome to Cooking for Cancer and Chronic Disease. My name is Angela Zaccanini, registered dietitian, and this is Eric Capozzoli, also a registered dietitian. Today we are going to bring you some snack ideas. So for the next few weeks we're going to be discussing different snacks based on the preparation level. So today we're going to be doing pretty easy, quick, convenient snacks that require very minimal preparation, pretty much no preparation at all.
Yeah.
Yep, so as you can see here, there's some things we have on the counter, and I'm going to zoom view some of these things, but we're going to get started with, I guess, these snacks, right?
Yeah.
Okay, so the first one we have here is a low moisture part skim cheese stick, mozzarella, and these Crunchmaster multi-seed crackers. So you kind of recommended these, right? They're whole grain. They're decent amount of calories for the serving size. So we'll talk about that. But people are looking for, a lot of times people are asking us about simple, quick snacks that are still nutrient dense. That's what we're really looking for, is the nutrition content of these snacks.
Yeah.
Right? So let's talk about this.
Yeah. So if you're trying to do smaller, more frequent meals, or just add in like a healthier snack or a higher calorie snack, whatever your needs are, these require no preparation. Cheese stick. This is easier. I mean, you can do just like pieces of cheese, different kind of crackers. These crackers are whole grain. I like them because they're just good. They're crunchy, and they are gluten-free if you have celiac, so that's another option. But you can do any kind of crackers. Peanut butter or an almond butter is also good on crackers as a snack with basically no preparation. So very convenient for what we have.
I like it. Well, let's break down the nutrition content for this real quick. So one of these cheese sticks is 80 calories, 7 grams of protein. So pretty good source of protein for that amount of volume.
Yeah.
You know, like very small. You can eat that within minutes. And then why we paired it with crackers is because we want our snacks, especially if you're doing more small but frequent eating, we want them to be over 200 calories per se?
Yeah.
Okay.
I mean, everyone's different, but around 200 is good for a snack. 200 or more. And trying to get it as balanced as possible across like your macronutrients. You know, your fat, carbs, protein.
Yep.
And we're going to get our protein mostly from the cheese, but then some from the crackers as well.
Yes.
So a serving is going to give us how many calories?
So a serving is actually 14 crackers, which is a decent amount. 130 calories, 3 grams of protein, and 22 grams of carbs. So about a carb and a half for your carb choices if you're watching your carbs as a diabetic.
Yes.
No carbs coming from your cheese, and then 80 calories and 7 grams of protein. So we have 210 calories and 10 grams of protein for this small snack.
Right.
Doesn't require any preparation, cooking, anything. You don't even have to portion it.
Yeah.
I mean, I guess you have to count out the crackers.
Yeah, and you can even do like, if, again, depending on your needs, two of these and, half the crackers, or 2 of these and the full serving of crackers.
Yep, love it. Okay. So that's our first snack for you. String cheese and crackers. And like Eric said, you can do the peanut butter that's almost comparison to the calories and the protein content of that, would you say?
Yeah, that'll be
similar?
a little more, but
Okay.
the protein is going to be more with the cheese, but
Okay.
pretty similar. A little more fat probably from the peanut butter or any kind of almond butter, cashew butter, any of that kind of stuff.
Okay. Let's take it to our protein bars. Or not even protein bars, I guess. What do you call these?
Snack bars?
Snack bars. I feel like everybody calls them protein bars, but that's not necessarily the case.
Right.
A lot of them aren't very high in protein, or maybe they're low in calories, high in protein. So that's really what we want to talk about today.
Yeah.
Is the nutrition content of some of these.
Yeah, and it's pretty they can be pretty difficult to find. You know, not that a lot of ingredients is bad, but something that's, you know, maybe has a little bit less ingredients and has the right kind of macronutrient content. You know, there's a ton of granola bars or protein bars in the stores, and these are just a few that we like. A couple different brands.
Yep.
For different needs. So our RX bars, these are a minimal ingredient bar, and they're going to give us 12 grams of protein, and the middle one's going to give us 10.
Okay, so 12 grams of protein for these two, 10 for this.
Yeah.
And the calorie range is from what, 200 to 230?
Yeah.
Is that what we said? Which again, we're in that range. What we want. We want high protein and, well, decent amount of protein, I would say.
Yeah.
And higher calorie to keep us full. And I do like these that they list the ingredients right there. You know, very minimal. There's nothing in there that you can't pronounce. There's nothing in there that you haven't heard of.
Yeah.
Right.
And not that that's bad either, too, right?
100%.
Because there's different, pronunciations for vitamins, minerals.
Yes.
Some additives in food that are okay, but yeah, if you can see it, you could technically make that yourself. It might be kind of hard though.
Yeah.
These ones you could.
Yeah.
Very easily.
Well, and one thing I wanted to mention is the texture. So I'm big when it comes to granola bars, protein bars. I'm very much a texture person.
Yeah.
So I like the consistency of these where they're soft and chewy. And a lot of our patients struggle with, some mouth sores or some difficulty chewing and swallowing. So these ones could be, again, a better option for that type of population. But again, that varies too.
Yeah, and these, with these, I actually cut them up into like little squares and eat them because they're the consistency of them. But yeah, these also similar consistency to the Larabar.
Yeah.
Now again, these are a lower protein bar. They do have calories in them and some fiber, but they're only, 200 calories, 3 grams of fiber.
Very low in protein.
And 4 grams of protein. So again, this doesn't really meet our requirements like we're talking about trying to get some protein. They did make a protein version, but they no longer sell that. That again could come into pairing. So you could have, this, some cheese, with the different flavor maybe with peanut butter.
Yeah.
Something like that.
A handful of nuts, maybe.
Yeah. So like some pairing may need to happen. The calorie mark is 200 or more is what we're trying to hit. Protein, if we can, 10 or more grams with the bars. And this Vital Performance is 20 grams of protein.
So the highest protein content we have found within our our protein bars.
Yeah. So it does have some fat in it, only 12 carbs too. So for our patients, with diabetes, if you're watching your carbs or counting your carbs, this is going to be a lower carb version or lower carb option. And this is 24 carbs, and these are 24.
So all again about a carb and a half choices.
This is 1.
Okay.
And then the rest,
About a carb and a half to almost 2.
Yeah.
Okay.
Another thing too with any protein granola bar, trying to get some fiber with them.
Yeah.
If you can. Now, really, the reasoning for these ones that we chose trying to help yourself, feel full. So we need some fiber, we need some protein, and they have some fat in them, which is good as well to help keep you satiated or satisfied.
We talk about balanced meals a lot within our career and to our patients, and it's just important to get a balanced snack.
Yeah.
So feeling full, no empty calories, getting you to the next meal or to the next snack is super important. So that's why we're really trying to break down that nutrition content here for you and really trying to go into the ingredients as well as the actual brands. Because, us as dietitians, we spend a little bit of extra time looking at those things that maybe you might not do. But it is important to do that, I think, just to get that knowledge and background. And we were talking about this too before we went on the air, that if you're really looking for that balanced, adequate protein, carb, fat, fiber, these two RX bars are going to be the ones that have the most balanced nutrition content, correct?
Yeah.
So decent amount of protein, that 200 calorie mark. They have, how much fiber again? 4 grams of fiber. This one has 5 grams of fiber.
Yeah.
So again, it's going to help, like you said, with that satiety. You're going to feel fuller longer to get you to that next meal or snack. Okay?
Yeah. And the other thing, you know, with just like accessibility, sometimes these can be expensive too. So
that's a good point.
Trying to get them like in bulk, trying to get them like at Walmart or you know, wherever you shop.
Costco or something.
Costco, something like that. But it is, you know, we always have to kind of take that into consideration. But because they have minimal ingredients, that's why they do kind of meet those requirements as like a meal.
Right.
That's why, if you have something that's more accessible to you that hits these numbers and it has whatever ingredients, you can obviously sub for that.
Okay, cool. Yeah, I think we bought these individually from Whole Foods. So again, the price is already going to be up, but I believe, these were $2.50 a piece.
Yeah, which can get expensive. So we're always want you to get Whole Foods if you can. So having some of this stuff on hand, if you don't feel like cooking, you don't feel like making something, or going to fast food or something, this is an easier, healthier option.
Definitely. Okay, good. So to wrap this up with our easy snacks, these are more supplemental drinks.
Yeah.
So these aren't solids.
Right, it's not a meal. It's
I don't know what I'm saying.
depending on calories with this too, if it could be a meal replacement.
Yeah.
Which we've done, or you've done. Oh, we did some smoothie videos. So
Yeah.
this would be first line would be if you can do a smoothie, we want you to make a smoothie. But again, accessibility, time, all those things. So
Convenience.
would fall in, definitely convenience would fall into some pre-bottled supplemental drinks.
Yes.
And these are some that we carry here at Hillman Cancer Center.
Yes. So we're going to break these ones down for you as well. I'm going to, if we can put them over here again while we go through them, and I'll swap the camera over. But
Okay.
so again, similar nutritional profile, what we're looking for. But these tend to be a little bit more nutrient dense. So they pack in a lot more calories and typically more protein for that volume, right?
Yeah. These are all, the drinks are going to be more calorie dense, and depending on how fast you drink this, sometimes this might not they won't satisfy you as much as chewing a meal, the bars even. But if you're trying to gain weight, these are what we usually recommend, because it's going to be easy access to those calories, and you can get them in faster.
Definitely. And again, to talk about the chewing, swallowing difficulty, some mouth sores, other things that occur during what we experience as cancer treatment, a lot of symptom management through cancer. These, again, are a good choice for those patients who are having trouble chewing, swallowing, and eating solids.
Yeah.
So we don't always encourage these, not for every patient, right? Would you say?
No, with any of this, the bars in this, I usually encourage to have either or both, just in case.
Yeah.
So because they're shelf stable, they usually, obviously check your expiration dates, but they last probably 6 months to a year.
Okay.
So having something, we want nutrition versus no nutrition. So something that you're getting in, sometimes a lot of our traditional supplements can get, my grandma drank Ensure or something like that, which is fine. We can drink what grandma drank too,
sure.
right? So something like Ensure, something like Boost, which are very
Common.
Super
common. You see commercials about them. You'll see them available here in cancer centers or any sort of healthcare facility, hospitals. That's usually, Abbott and Nestle are the common reps that are found within healthcare facilities, so these are going to be readily available. But nutrition content, break it down for us.
So with these, again, we want to, for this, I like a little bit more because what I'm recommending this for is to gain weight or to maintain weight. So 250 or more calories, and then 15 or more grams of protein. Some of these are going to have fiber in them, but not. It's going to be pretty minimal. And the Ensure, these are like kind of the competing brands. Got them.
Yep.
So we have the
Move them up a little bit.
the 350, which is definitely over our 250 mark, and then 30 grams of protein. So it doubles the protein.
Mm-hmm.
And then 360 for the boost and 14 grams of protein.
Mm-hmm.
Now, you notice this is a little higher volume, so depending too, if you're having issues swallowing, you want something that has a little less volume. Now, they do make a boost very high calorie that's 530 calories, I believe.
Yes.
Same amount of volume, so it's going to be thicker the smaller it is. So if you're having issues with thickness and you want it to be thinner, you can thin these out too with water, milk, dairy milk or almond milk, something like that. Now, carb-wise, they are going to be high in carbohydrate. So if you have our patients with diabetes, there's 42 in here. So that's counted like 3 carbs, right?
Yeah.
And then 45 in here. So again, that's almost going to be like a meal replacement carb-wise. And plus, as you're drinking it, you're not eating a meal, it's probably going to hit your blood sugar harder. So just to kind of take that into consideration. Now, there are the lower carb drinks.
Yep.
They both make Glucerna would be for Ensure, and then Boost Glucose Control for Boost.
Yes.
Which would be, I believe they have like their 1 carb for each of
Okay.
those.
Okay.
But also, they're less calories.
Right.
So depending on what we're doing, we can split these up too. If you want to get 350 calories in a day, split it up, drink half of it, put it in the fridge, drink the other half later.
Yep, I like that recommendation for sure.
Yeah.
I also like the fact that these come in different flavors.
Yeah.
Depending on what someone's looking for, that can, be based on their liking. So we talked about them being available here in Hillman in the hospital, but these can also be found on the shelves anywhere, pretty much. So Walmart carries them, CVS, Walgreens, Rite Aid,
Yeah.
Target. I mean, really any place that has a pharmacy,
Yeah.
right? You'd find these.
Yeah, and also bulk too. Like we talked about the bars.
Right.
The more you get, the cheaper it's probably going to be. So Sam's Club, Costco,
And
any of the wholesale clubs.
And I know a lot of places like that actually sell their own brand.
Yeah, which
So-
can be cheaper.
Right. So Walmart, for example, has Equate
Yeah.
is their brand, which is, again, similar nutrition content to these, but maybe a few dollars cheaper. So again, when you're looking for convenience, things tend to cost a little bit more. So you have to consider that. We always tend to carry coupons. I know a lot of times those big retail places have coupons for these options as well. So just something to consider.
Yeah, for sure. And if you just need to have them on hand, that's good. But if you're needing to do them daily, because you're really struggling with your treatment, and then I would, some insurances will cover these too. You can always reach out to your insurance provider and just see if you have an oral supplement benefit, and then, you can get them that way.
Yep. Okay. Real quick before we get into these ones, these are not plant-based.
Right.
These do contain milk-based proteins, but they are suitable for lactose intolerance.
Right.
So they do not contain that lactose enzyme that tends to be an issue for a lot of people, but it does contain milk protein. So if you have a true milk allergy, then these would not be appropriate, correct?
Yeah.
Okay.
Yeah, so they have the lactase added to them that breaks down the lactose sugars.
Right. Okay.
So if you're lactose intolerant, you should be able to tolerate these.
Yes. Okay.
Not if you're dairy intolerant, though.
Yes. All right.
So we can talk. So these last 3 we have. So this is kind of in the same vein as the Booster Ensure. This is an organic product. Orgain is the brand. Also can be found pretty much the same places that the Booster Ensure can. This is 250 calories, so it's hitting the over 200 mark, and just looking at the carbs here. So 16 protein and then 28 carbs. So that's 2 counted carbs and then It's 1 gram over the amount of protein that we would recommend. So if you're maybe not tolerating the Boost or Ensure and you want to try something a little different, these are not as sweet. They don't have as much sugar or carbohydrate in them. So if you like something a little less sweet, and if for some reason you'd want to do organic, you can obviously pick that.
Okay. This one's not the plant-based one, correct?
No.
Okay.
So, and then our last ones, this is the plant-based version of that Orgain.
Right. Okay.
Yeah, so just the blue. Also has 16 grams of protein, and it's 240 calories. So 20 grams or 20 calories less. And then carb-wise, it is 30. So the same carb-wise, so 2 carb choices. And it is plant-based, so no dairy at all for that. And then the last one we have is the K Farms. So this is another good company that we work with. Their reps pretty closely. It's a fully plant-based product. This actually is one of our higher calorie drinks as well. So this is 455 calories. This comes in chocolate, vanilla, and plain. And protein-wise, we're looking at 20, I believe. 20, and then it has 50 carbs.
And how many calories in that?
455.
Okay, so
this
super calorically dense.
Yeah, so this is definitely like a meal.
For sure.
Yeah, because it's almost double the amount of calories that we're recommending for a snack or small meal. But it, again, if you're needing to get more calories in and you're having issues with eating, especially chewing, swallowing, this is for sure what you want to go with. And you can split these again, because these are, you can tell these are bigger. They're 11.6 ounces, I think. And the other thing with any of these, especially the lower calorie ones, you can use these as a base of a smoothie.
Yes.
So
I even like that for the Kate Farms that's plain flavored.
yeah.
So that could be utilized in a lot of other things where you're adding your own flavors. But one thing to mention about the Kate Farms, that is not something you find on the shelves like we just mentioned about Walmart, CVS. That is something that's going to be like pharmaceutical based, right? That you would actually have to go through a rep.
No, you can get them online.
Okay.
So it's just online.
Okay.
They do have like other flavors that are not considered like sole source nutrition on their website. These ones they have on their website as well, but because of the calorie density, you're paying for calories, so they're going to be expensive too. But there are discounts. They offer discounts for all of these. So if it's something that you need, I would definitely look into it. Obviously reach out. Dietitian can help you kind of wade through those waters.
Okay. Great. All right. Well, I believe that's all we have for you for our easy preparation or minimal to zero preparation snacks. We're going to be bringing you something a little bit more labor intensive during our next class. But again, nothing too crazy.
No.
But again, we'll break it down similarly. Oh my gosh.
Similarly.
Thank you, Eric. To what we did today. So I think that's important, though, to kind of break that down for all of you so that you don't have to do it, right?
Yeah, and if you, obviously have questions, email, or,
I'll put that.
Leave us a comment, and we
Bottom.
can try our best to answer whatever you have for us. Yeah, we're just trying to make it easier. I mean, I know people are reading a lot of nutrition labels and get kind of bogged down. Trying to make that a little easier.
For sure.
Especially with this kind of stuff, and whatever's accessible to you, but just trying to have some of this stuff on hand if you can.
Yep.
Based on your own needs.
Yes, love it. Okay. Again, shoot me an email like Eric mentioned or leave a comment and we'll get back to you. Thanks so much. We'll see you next time.
Thank you.